opportunity. I have chosen this topic because, as we know, the chronic pain it is the number one disability cause in the worldwide now. And I would like to proceed my presentation now. As you can see, my research topic in benefit of the integrative medicine on the pain management in the oncology. So this is a research of evaluation of the current evidence. Okay. So as you can see, why I have chosen this for research, not like this, as it is due to the and in the here, pain is a sensory and emotional experience with the actual and potential damage of the tissue individual experience and express the pain differentially. And 55% of the patients they undergoing the treatment for the cancer, they and the 66 the patient metastatic or terminal cancer, they also experience the pain. So for the pain management, we need to really think about in a cancer patient. As you can see, this is the data taken from the American Cancer Society. It has shown like for the most common type of cancer in the US for the female, as you can see, the 30% they suffer for the breast cancer. And the second most common among the women, it is like a lung carcinoma. When you compare with the men, the most common cancer, it is a prostatic cancer, which is 27%, and the lung cancer, which is a 12%. So pain is a clinical challenge, even for the many oncology patients, clinicians, evidence that showing this integrative therapy, it can be useful in the pain management. So before going to this integrative therapy, let me introduce you what is the integrative oncology or what we consider into the integrative therapy. So this integrative oncology, they aim to optimize the health, quality of life, clinical outcome across the cancer care continuum to empower the people to prevent the cancer and become active participants before, during, and beyond the cancer treatment. So new recommendation, it came in September 19, 2022. This is a new joint practice guideline by the American Society of ASCO. They has been published to address the gap in the healthcare provider knowledge of how to safely and effectively treat the common cancer symptoms and the side effects using the integrative medicine approaches. So they develop a clinical practice guideline on the use of this integrative therapy in the pain management. And the aim of this evidence-based therapy is to provide the recommendation to practicing physicians and other healthcare providers on the integrative approach to managing the pain in a patient with the cancer. So what are all these alternative medicine which is helpful for the cancer chronic pain? So as you can see, the acupuncture, they relieve many pain, nausea, vomiting into the chronic cancer patient. Aromatherapy, massage therapy, hypnosis, meditation, music therapy, these are the names of these alternative medicines. So these are the beneficial therapy which has been already been proved help for the chronic pain, but the Joint Commission of American College of Physicians, National Comprehensive Cancer Network, and the American Society of Clinical Oncology guidelines, all they recommend the combination of pharmacological and non-pharmacological. The pharmacology which we give the medicine, non-pharmacological modality means incorporating this integrative medicine such as the mind-body practice, acupuncture, massage therapy, and music therapy. It has shown in various clinical research, it has shown that gives the benefit for the chronic pain management. All form of these therapy, they work in a different way by which the patient can manage chronic pain and not depend upon the anesthetic or like other opioid like medicine has a side effect to the patient. So let's mechanism of these alternative therapy like massage and acupuncture example. So as you can see, pain pathway in the various clinical studies that show the therapy, alternative therapy like massage, the nocebo activation, injury, and inflammation. They relate neuroplasticity from cause, even modulation of cognitive and emotional evaluation of the pain as shown by the mind-body technique, by the massage. So these are mechanism of action which has shown in various ways. In the clinical finding for the medication, it has the natural killer cell cytotoxicity and also decrease the inflammatory cytokine and cortisol level. Similarly, hypnosis also decreases the pain, distress, anxiety. Yoga increases the natural killer cells, improve the mood, decrease even the anxiety, anticipatory nausea and depression. So these are the mind-body therapy which is available already. And apart from that, acupuncture has shown for management of the chronic pain that I will discuss now. There are different complementary and alternative medicine therapy which I wanted to enumerate. One is like acupuncture, massage therapy, mind-body therapy. That mind-body therapy is really, really helpful for the chronic pain, nausea, and anxiety, and even the mood disturbances. Okay. These are the different therapy, as you can see, and these are the characteristics of these treatments. Like for the body-based manipulative practices, they shows the manipulation of the soft tissue in an effort to affect the muscular and nervous system therapy, like massage, exercise, and reflexology. That is like a body-based manipulative practice. Alternative medical systems like mind-body therapy that also enhance the bodily function and mind, such as the therapy include the meditation, Tai Chi, hypnosis, and yoga. So these are the therapy has definitely shown the benefit into the chronic pain. For the methodology, I have approach for last 10 years of for clinical research and clinical research which has done even to the randomized control trial. I have looked onto those research with these keywords like integrative medicine, chronic pain, or the chronic pain management in the cancer patient. So here in this study, I have summarized our current body of evidence from these studies. So this is the result of our search. As you can see, this literature search identified the relevant study to inform the evidence-based recommendation to practicing physicians. So among the adult patients, the acupuncture, as you can see here, the acupuncture should be recommended for the aromatase inhibitor. Aromatase inhibitor, we know that causes the side effect like joint pain. So with the use of aromatase inhibitor, many cancer patients, they'll end up with the joint pain. Acupuncture has shown a significant benefit for the aromatase inhibitor related joint pain. Acupuncture and even the reflexology that has shown or recommended for the general cancer pain or musculoskeletal pain system. Hypnosis, you can see over here, the hypnosis may be also recommended to the patient who experience the procedural pain, and the massage therapy, they might be recommended to the patient who are experiencing the pain during or hospice care. So these are the recommendations. They are only based on the intermediate level of evidence, benefit owing the risk that everyone know, and to extent these recommendations is like an intermediate recommendation as we found in our result. In the acupuncture of randomized control, and in a Cochrane review of the RCT, they have shown the acupuncture of cancer related that has shown a significant number like 45. In this 5 study shows the acupuncture was superior to sham acupuncture or superior to equivalent to oral medication administered according to the WHO analgesic scale. In one of the clinical trial settings, the serious adverse events are rare find. If you ask me, what about the side effect of these integrative medicines? So I have searched both the efficacy and the side effect of integrative medicine. So we have found only the 0.005% of the patient and 0.0008% of the treatment. They have found like some of the side effects, 56 with the current level of evidence, and if you ask me about the side effect of these acupuncture, there are rare side effects and like only injectable side effects will be there with the acupuncture. So among the adults, acupuncture should be recommended for aromatase inhibitor related joint pain according to the recommendation, and acupuncture and reflexology that has shown also a very good benefit for the general cancer pain patient or for the musculoskeletal pain. About the yoga, yoga demonstrated even the non-inferiority compared to other traditional methods such as the physical therapy or the management of the chronic pain. As you can see, the yoga displayed the significant result in the reduction of intensity of chronic cancer pain, the adverse effect. So, as I mentioned, for the acupuncture, there was some adverse effect reported because acupuncture we are injecting the needle. So, the needle side, there will be inflammation, sensitivity reaction. It can bleeding. That is a problem with acupuncture, but the yoga has the safest in among all the alternative medicine. I would say has the safest in the improvement of anxiety, sleep quality, pain related activity and impairment, and the quality of life. On the left side, I have shown the how yoga affects the different muscles, and as you can see, it has shown the muscle in strength has increased, like with the external oblique muscle over here and the gluteus maximus muscle that has shown with the different position of the yoga. Okay, but as I mentioned, the yoga also has a positive, showed the positive benefit for the cancer pain, and that were maintained even the month after the implementation that has shown in our result. There are some lower quality of evidence also in my research, like for the massage therapy, it has shown the pattern experiencing the chronic pain following the breast cancer treatment, the hatha yoga, that patient experiencing the pain after the treatment of breast, head and neck cancer. It has shown a benefit on these patients. Some of the therapy and undergoing the cancer surgery, other cancer related processes such as the bone marrow that show the benefits of that. Music therapy. Therapy patient experience the surgical pain, the cancer surgery. Some, some of the music therapy as I mentioned, has shown the general for and also the musculoskeletal pain. Apart from that, incidence, lower quality of evidence shown on the patient experiencing the chemotherapy induced the peripheral neuropathy. So these are like a ASCO guideline for the integrative medicine of the pain management. And then I concluded like the conclusion of the study, as you can see, the Center of the Disease Control and Prevention indicate that the non-opioid therapy, it is currently should be preferred method of the managing chronic cancer pain, because as we know, these cancer patient already they are taking a lot of medication, giving them for more and more like opioid or other NSAID, other painkiller, they might have a lot of drug interactions or the side effects or the toxicities which they can face. So the literature has identified these relevant studies to inform this evidence and recommending all the physicians to incorporate these alternative medicine along with the pharmacological treatment. I'm not saying giving only the alternative medicine will be the cure, but incorporating the pharmacological treatment along with this non-pharmacological management like the massage therapy, yoga therapy, that will definitely improve the pain, definitely improve the patient's pain for like the chronic pain, which is like a chronic cancer pain. So among the adult patient, acupuncture has already showed the aromatase inhibitor related joint pain and recommended for all the physicians, even recommended for the general cancer pain and musculoskeletal pain. Similarly, the hypnosis has been recommended for the procedural pain and massage is recommended for the who are